certainly mortality as an endpoint in trials is important. Does what we're doing save lives? We have to know that. But as more options become available, we have to think beyond mortality. And we're learning more about, and we need to think about exactly what you're talking about, these long-term consequences, such as post-PE syndromes, pulmonary hypertension, CTEPH. Those can have significant impact on patients' quality of life. And quality of life, functional status, and also the psychological aspects and impact of PE on patients is so underappreciated. And as a medical community, we have not investigated that. And this is such a gap. And I think when you think about, look at the objectives of most of the therapeutic trials. The main focus is on the current care of patients with VTE, prevent recurrent VTE, anticoagulated associated major bleeding, and death. And those are highly relevant clinical outcomes. But exactly what you're talking about is they don't capture the patient relevant outcomes, such as quality of life, functional ability. And decreased quality of life and functional limitations, they happen after both deep vein thrombosis and PE. And some studies actually show it occurs in up to 50% of people. And I think these long-term complications, if you think of post-PE syndrome, that's ongoing shortness of breath and dyspnea, exercise limitation. And if you think about post-thrombotic syndrome, pain, swelling, ulceration, those we haven't really explored. And I actually think we know a little bit more about PTS, the post-thrombotic. That's been recognized for a long time as a complication of DVT. But I think the post-PE ones only recently recognized as potentially really debilitating. And I also think what you mentioned, which is the quality of life. And I think, post-VTE syndromes have been associated with high risks of depression, unemployment, social isolation, and excessive healthcare costs. So there's actually a study that a first VTE episode was shown to be associated with a 52% increased risk of work-related disability and 38% of patients not returning to work within the first year. So that economic burden is huge, and it's estimated to be about $200 million. I would also say that the whole gap with the post-traumatic stress disorder, and I will just share one patient of mine. So she passed out from her PE. She woke up in an ambulance, and fortunately, she was saved. And she came to my post-PERT, actually PE follow-up clinic, and I looked on her record, and I saw that she'd been in the hospital like 6 times since her PE. And I said to her, "Wow, what's going on?" And she said, "Well, every time she heard an ambulance, she had a panic attack and had chest pain and shortness of breath, and she ended up in the emergency room." So I said, "Okay, well, we can help with that." So she actually did some cognitive behavioral therapy, and she can now hear an ambulance and not rush to the emergency room and not have a panic attack. So, but those we don't really understand that, and so I think there's a real gap in between kind of these quality of life, the psychological impact, functional impact, and I really think we need to understand these. And in fact, I'm so interested in this that I've created something called the CLUES blood clot study, so CLUES. And it actually stands for a critical look at understanding the emotional suffering of blood clot survivors. So it's actually 14 validated surveys that are put together. And we've actually sent out a call to all blood clot survivors that we need to hear from them, because we know the physical toll that blood clots can take on patients, but also the psychological impact. And we need to learn from patients. What are the emotional issues it's caused them? Have they experienced anxiety, post-traumatic stress after having a clot? And they're really the experts. We need to learn from them.